Becoming a nurse leader at the bedside involves many different aspects of care. In every clinical area, including this cardiology office, one of those care aspects involves protecting patient privacy. The focus of this project was to find a way to decrease personal privacy violations in an office setting. This is important to do because decreasing privacy violations improves patients' quality of care and protects the office from being sued or fined. My project collaborators included a staff member from each office department. Renee, office manager, Mary Jo, RN and clinical manager, Jill, medical records and clerical manager, Sarah, medical assistant, Alex, scheduler and secretary, Emily, RN and stress conductor, and myself, RN, care coordinator and project leader. Each person reported on the privacy violations occurring in their department. This included PHI, facing upward, passwords near computers, and sometimes verbally speaking about a patient when another patient could have been within hearing range. So each person reported on those violations and suggestions for improvement and ways that patient privacy was improved in the end after the project was completed. Sarah provided the idea for a noise machine, Alex implemented using the glass partition at the front desk, and Emily advocated for a patient health information bin to be by the printer so information could face the wall. Renee discussed and approved project changes to the office and advocated for their implementation when barriers became present. The specific aim of the project is to decrease personal privacy violations through the use of training, feedback, and mock HIPAA reviews over a 5-month period. The process that is being changed is the employee's attention to protecting patient privacy. The activities used to support this are placing visual reminders strategically around the office to remind staff members to protect PHI, providing extensive education to employees on how to reduce privacy violations, and performing surveys and mock audits to further drive home the importance of protecting PHI in the office. This change is needed because decreasing privacy violations improves patient quality of care and again protects the office from being sued or fined. The PDSA cycle, or Plan, Do, Study, Act, was very useful in planning what changes needed to be made and then doing them. Once the changes, as mentioned above, were made, the work environment was studied to see if these changes were effective. If they were spread to another department. If they were not, it was back to the drawing board to determine another way of meeting the project aim. For example, the noise machine was not effective in keeping the person in room A from hearing everything said in room B. The wall separating the two rooms is thin, and so the noise machine was purchased in an effort to mitigate that problem. However, it was not effective, and so it was actually effective in keeping the hallway conversation from being heard. So now plans are being discussed for a construction project to better soundproof between these two rooms, and the noise machine is being utilized elsewhere for the hallway noise. This is just one example of how the PDSA cycle guided this project and greatly impacted the final outcome of decreasing personal privacy violations. The process of implementing and spreading the change was simple. Perform the changes and see if they took root and were utilized to decrease personal privacy violations. A key facilitator to the front desk scheduling area was Nina, as she took the initiative in posting another sign to better protect patient privacy. This sign was to instruct patients to stand farther back from the window so the patient at the window wouldn't be overheard. She accepted the changes implemented and took it further to improve patient privacy. Barriers to the changes implemented included resistance to change in general. It's very easy to just get used to your workflow and not be able to make changes easily. And there was a lack of motivation. These barriers were mitigated through encouragement and verbal reminders, discussion of the cost of privacy violations, and the public support of my manager to implement these changes. She helped facilitate participation and adherence to the changes implemented. The real and continuing anticipated impact on office practice is a decrease in personal privacy violations and an increase in knowledge of how to prevent such violations from occurring. Evaluation measures conducted to measure achievement of the project aim included feedback in the form of discussion and a survey that was utilized to determine staff satisfaction and suggestions. A final mock HIPAA audit was then utilized to inspect each office department and look for compliance with the introduced changes. The final HIPAA audit also monitored for breaches in verbal, paper, and computer PHI. This mock HIPAA audit showed a significant decrease in privacy violations, including less paper patient health information facing upward, no more passwords in view for the EMR, and fewer instances of unintentional verbal sharing of PHI. This shows that our specific aim for the project was achieved. Thank you.